with a good evening and welcome to the Town Board of the Town of Austin regular meeting for Tuesday, February 23rd, 2021. Please rise and join me for the Pledge of Allegiance, and then please remain standing for a moment of silence. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Excuse me. Oh, and I asked everybody to stand for a moment of silence, and then I forgot. I'm sorry. So this week, the United States reached a very sad milestone: 500,000 lives lost to COVID-19. That amounts to an average of nearly 1 death per minute in the past year. We are hopefully rounding the corner on the pandemic, but it is important for us to pause and recognize the sheer loss we've experienced as a nation in the past 12 months. Please join me for a moment of silence to acknowledge the many beautiful lives we have lost this year. Thank you. So we had a surprise guest that is going to be joining us. I'm not sure if he might be in the waiting room. No, he's not. But as soon as he gets here, we're going to probably put on hold our regularly scheduled program for the evening. And we will ask him to speak, and that's our County Executive, George Latimer. So he's not quite here yet. So let's start with our roll call, and then we can go into, we have a departmental report from, perfect timing. He heard us, but we can still, let's do our roll call, and then we will invite our County Executive to say a few words after, I'll give him a little brief introduction. So should we start with the roll call?
Councilmember Feldman?
Present.
Councilmember Shaw?
Present.
Councilmember Meyer?
Present.
Councilmember Wiltshire?
Present.
Supervisor Levenberg?
Here I am. So tonight I am pleased to introduce the Westchester County Executive, George Latimer, as we stream live to Facebook to hear a COVID-19 update from the county. My staff and I have had the opportunity to be part of the team for weekly updates since the first case was identified in Westchester 1 year ago. We've been very grateful for his leadership during these trying times, both in the COVID-19 response and other areas of county government, from police reform, which is still ongoing and in the works right now, to pulling off an election season like no other, to ensuring the county as a whole is working towards its housing goals and remains a welcoming place for all who wish to live here. With that, I'll turn the Zoom mic over to you, County Executive Latimer, and thank you so much for stopping by Austin, or Zooming by.
Thank you very much, Dana. It's a pleasure to be with you all. I know that you've got a long agenda already, so I will try to keep it short. But as Dana pointed out, we have these meetings on Monday afternoon 3:30 where we discuss issues, and usually the chief elected official or the administrator will participate. But I wanted to make sure that I gave a chance to let the full council know what's happening as we see it at this moment, and then answer any questions that you may have. And then I know the invisible hook will come out, and off I go. I wanted to first of all highlight that we're just about through the first full year of the pandemic. Nobody could have envisioned what this would have been like when it started on March 3rd of last year when we had our first case. We rapidly went from 1 case to 1,000 cases to the epicenter of the East Coast. But in all that time since, we've learned a lot about the disease, and of course with the coming vaccine now, we really have an opportunity to see the end of the tunnel, even though there's a lot more tunnel that we've got to go through. First of all, the numbers through yesterday. We have 6,264 active cases of coronavirus countywide. That's not a small number. It represents that of the 105,000 people that have gotten coronavirus that we know of in the county, tested positive at some point in time over last year, 98,900 of them have cleared the 2-week period of time to determine whether they're sick or they beat the disease. That leaves 6,200 people as of today that are not yet cleared. The protocol And to look at the trend line, a week ago today, we had 6,800, almost 6,900. 2 weeks ago today, we had 8,200. 3 weeks ago today, we had 10,283 active cases. And if you go back 4 weeks ago, we had 11,259. So clearly over the last few weeks, we're seeing a diminution in the amount of active cases. That's obviously good news. We don't want to draw too many parallels, even with a 5-week period of time. That's certainly a trend, but whether the trend is going to continue, we don't know. And so we're going to have to continue to monitor the numbers. We saw a tremendous rise in this second bell curve that started in the fall, September-ish, October, and it rose up during the Thanksgiving, Christmas, New Year's holiday period. And we spiked up. We were at our peak. We were at that 11,500 active case number, almost to 12,000. 12,000 was the peak that we had in the spring, for the most number of active cases we had when we were in the heart of the first time around. The biggest difference between the spring and the most recent fall-winter season is the severity of the disease has not affected us as much as it did then. For example, on hospitalization, our current hospitalization number is 383 people hospitalized to COVID. A week before that, the number was 412. 2 weeks before that, 498. 3 weeks before that, 502. 4 weeks before that, 566. And that was on the upswing of the second bell curve, now coming down. So from 566 down to 383, that's a good direction, and hopefully we'll continue to go. In the spring, the peak we had was 1,200 people hospitalized at the peak for COVID. Now, when you saw in LA County or in South Texas, in Italy and Lombardy a year ago, when you saw that the system couldn't handle the amount of people that were sick, that was they didn't have sufficient hospital beds and ICU beds. Here in Westchester, even at the peak last year, when we were 1,200 people hospitalized, we still had, 2,500 to 2,800 beds in the county. So we never broke much beyond the 50% availability of beds. That's a good sign. And now that we peaked out this cycle about 600 hospitalizations, we're down now below 400. That is a good sign of the direction. The fatality numbers are sobering. We've lost 2,070 people to coronavirus countywide over the course of this year. And when we track that, we track it basically by weeks. So in the last week, we've had 39 people die of coronavirus. The week before that, we had 57 people die of coronavirus. And the week before that, we had 75 people die of coronavirus. So the numbers have come down, but let's be human about this. Every death is a tragedy. Somebody loves that person. Somebody was that person's next door neighbor. Somebody was that person's friend. So even one death is difficult for us to accept. And we've had 2,000 of them. We do have a memorial service coming up next week in White Plains to honor at the 1-year anniversary all those that we've lost to coronavirus. Flags are going to be at half staff. We were planning to do it anyway. The president has now required that across the board. But the less deaths we have, the better it is, and those numbers are going down. So from the standpoint of the infection, we're seeing less of it at the moment. We're just about to the point where it doesn't appear we have had a Super Bowl Sunday spike because of what happens on Super Bowl Sunday. We're slightly past 2 weeks from Super Bowl Sunday. Look at the next couple of days, see if the numbers peak up a little bit. If they don't, and they continue to go down, then we pass that next area with some positive. But as well as I do, all the stuff that we would have done in person that we've sacrificed, all of the public activities, the concerts down at the river that you have in Ossining, and so many other things that we have, the ball dropping in Times Square and also in downtown White Plains, the various parades, the Sleepy Hollow Halloween parade, that's always a lot of fun in your general area of the county, that had to be canceled. All these things have been canceled, the public side of it. So when you see the infection moving, it really is driven by individual action, people who are doing things that go beyond what the public can control. And we're certainly not going to send in the police to knock on your door to find out who's at your dinner table. So hopefully it's a good sign. We're in a foot race between the infection and the vaccinations. And right now, so much of the discussion is about vaccinations. I'm sure people come up to you all the time as elected officials or as town officials, and they say to you, I need a vaccine. How can I get one? Can you get me on a list? What if I go late at the end of the day? Will they have extra vaccine? There's a host of different things that people are concerned about. The biggest single problem we have, you've heard it on television, and we are experiencing it, is there is not yet enough vaccine product to satisfy the demand. So you have a dish of cookies, there's 10 cookies on the plate, and there's 30 people in the room that want a cookie. And there is no way that you can accommodate the demand with only 10 cookies. You need more cookies. And then if you change the eligibility, you say, well, okay, let's open up the eligibility to restaurant workers because they should be vaccinated. Fine. Open the door, add another 30 people in the room, but you still have only 10 cookies. You have 60 people now, 10 cookies. So the real problem underneath the frustration that people have about getting an appointment, they go on the site, there's no appointments. There's no appointments because you can't make an appointment unless you have the vaccine available. And they don't know they have the vaccine available because the volume of production has not reached the point where we can vaccinate everybody. And as you know, we're not vaccinating everybody right now. There's very specific cohorts of people that can get the vaccine. If you're over the age of 65 or older, you're eligible for the vaccine. At any age, if you have an underlying health issue, a heart disease, a COPD, if you've been treated for cancer, treated for AIDS, if you have diabetes or hypertension, all of those are comorbidities that lend itself to vulnerability to COVID. You can get a vaccine. You're eligible for that. The state's made that possible as well. It's not everything that might ail you. If you have a bad back or knee problems, those are muscular. They're not tied into what COVID would do, so they don't amount to comorbidities. And then also, the state has allowed for certain occupational categories to receive the virus vaccine. So police, fire, EMS, all the healthcare professionals, nurses, doctors, dentists, you name them, they're all ineligible. They are eligible, I should say. Bus drivers are eligible. Taxi and limousine drivers are eligible. Restaurant workers are eligible. People who work at developmentally disabled facilities are eligible. Funeral directors. All of these rules are created by the state, and not by the state legislators, but by the governor. The governor, back in March of last year, established his authority over the state to establish by executive order the decisions, and all these decisions that have been made, where we're going to have testing centers, what kind of data is going to be available that you and I can see. Some gets to the county and we disseminate some of it. All of those things. What business is open, what business is closed. You've gone through and auditing a yellow zone designation. The governor had the authority to do that, and he did that and it created some restrictions, which he recently lifted. So in all of these things, we're working to try to get as many people vaccinated as possible. As we sit here today, about 120,000 vaccines have been administered by some source or another in Westchester County. The single biggest source is the county center, which is a state-run facility, which the county and Westchester Medical Center are partners in the administration of it. And that center produces more than 1,000, 1,200 vaccinations a day, and it operates 7 days a week, 8 to 7, 8 in the morning to 7 in the evening. And so it's really cranking out major numbers. The county has 2 health clinics, one in downtown White Plains on Court Street, and we've established one over the county community college, and we have done about 10,000 vaccinations between those 2 facilities. County center is approaching 70,000 vaccinations. And then the remainder are all the pharmacies that get an allocation from the state. They've also done some of these pop-up facilities in which the state identifies a partner in the medical field and a partner in a community organization, and then they provide 200, 300, 500 vaccines to be disseminated in that area. It has been done in Peekskill at the Kiley Center, down in Mount Vernon, Yonkers, and so forth. There is some rumblings that Ossining will get one of these pop-up centers working through Open Door, but we're not privy to know. I gather, unless you know, you're not privy to know. We're all going to find out when the governor decides that, we get that information. But the combination of all those things, really this construct has been done, by the governor of the state. What they basically said is you go on to the computer system and you register the state system, and then you look for an open spot at one of the state-sponsored facilities, with the major one being the county center. They're going to be opening a second one in Yonkers at the Yonkers State Armory down on Quincy Place, just north of downtown on the west side of Yonkers. We know that they need to have these kind of centers all over the county. We need to have one in northwestern Westchester, which would be some place that involves Ossining and Peekskill, something in the northeastern part of the county, something in the southeastern part of the county that might serve New Rochelle and some of the communities down there. But for the meantime, what we're dealing with is allocations that go to the state-run center that could take people with comorbidities or across the board. Senior citizens 65 or older through the local pharmacies that get the allocation, and the state determines which ones get that. And the county has been tasked with giving out the vaccinations for occupational groups. So we've tackled police, fire, EMS. We're fairly well down the road in completing vaccinations for all the police, fire, EMS that want it. I'll get to that issue in just a second about how many people don't want to take it. We are now working on teachers. And as I'm sure you know, there are more teachers than there are police, fire, EMS added up in the county. And the pressure on the school districts to open up is in direct proportion to how many people can get vaccinated. And our ability to vaccinate people is directly proportionate to how many doses we get. If we get enough doses, we vaccinate everybody that needs to. But those categories of people are not the majority of the society. The majority of the society, under 65, not ill, and not in one of these special occupational things, are not yet eligible to get the vaccine in New York State. Different states have different rules. If you have a friend in Florida, a relative in California, different rules in every state. And you know, where I live in the county, I'm a little closer to the Connecticut border. They're just changing their protocol, and there's always a lot of across the border, you know, go over to Greenwich, Greenwich comes over to Westchester type of issues in our side of the county. To try to pull this into a bit of a summary here, we have asked the town and the village of Ossining to develop lists of homebound individuals, probably seniors, so that when we get a green light and we can go out and do mobile inoculations, we'll be able to do that, and we'll know who those people are. We can get a team out there to do that, and that would best be done with your advice and direction. If we do get a call about a pop-up center and they give us advance notice as to where would be the best place to do it, then we turn to the town and the village to say, where do you think the best place to do it in Ossining would be to reach the right number of people if they're going to be a pop-up center. And as I said, there may be one coming shortly. I hear a rumbling, although I don't have any specific information. And then also to make sure that if there's any, as we did a little bit of it during your yellow zone situation, if there's any PPE that you need for us to try to get, hand sanitizer, those types of things, if it's helpful and targeted to a particular community, an entity, an organization, we will certainly try to do that for you. We are your partners. We're not your boss. We're like your brother. And you turn to your brother, can give you a hand? Yes, we want to give you a hand. And you've got a terrific advocate in Catherine Borgia, as you well know. She's one of the most prominent county legislators. She's a good friend of mine, but she does not have any problem standing in this office yelling at me if she thinks I'm not doing enough for Ossining. So you're covered there. And of course, my longtime friend, Sandy Galiff, in the assembly is also doing everything she can. So we're trying to work together. I'm happy to answer any questions, but at least to get you up to speed to where we are vaccination-wise, infection-wise, county-wide, hopefully it would be helpful. We have put a dashboard together. We report as much information on that dashboard as the state provides us. And if you look at it and you say, well, how come we don't have this and how come we don't have that? We've asked for it, but the state is, is releasing data as they see fit. And again, the state is not the legislators, it's the executive branch. So with that, I'm going to show a modicum of self-control and see if you have any questions, and then that invisible hook I know will let you get back to the rest of your work tonight.
Well, the good news is, County Executive, we could have you here all night because we have a very short agenda. But
I think you put that up to a vote. I do not think that vote would pass. Let's have George Latimer talk all night.
Because I have had the opportunity to ask questions as recently as this Monday, and I usually take that opportunity, as you know. I'm going to open it up to my board colleagues to see if anybody has any questions or comments, suggestions, or otherwise for the county executive.
Well, first, I'd like to commend you on how smoothly the county center is running. I've gotten a lot of feedback from patients and people that that's the location that's really going the best. A couple of glitches, but really, some of them have called it a well-oiled machine, and that's been really nice to hear.
It is great.
I was vaccinated at the medical center. That was not a well-oiled machine. Mm-hmm. They had a glitch in scheduling the first time, and I think they weren't crossing off the appointments as people made them. So I think 100 people showed up for the one appointment. Oh. So it took 2.5 hours, but they got it worked out. But it was done. Do you know how many people were vaccinated at the medical center?
I don't. The medical facility numbers are not within our scope. We saw an aggregate number that we received from the state That was 100 and I alluded to it as being over 100,000 total. I think it was about 112. And that was as of last week. But they didn't break it down for us, Liz, so we don't know. But, you know, the governor likes to parcel things out and compartmentalize things. So I think he sees the hospitals doing one set of things, and we don't need to know what he's doing there. So
I do think that your dashboard now is showing how many doses are being allocated here and there. So we're starting to see a little bit more detail.
Yeah, that's on this point forward, going forward. But what's happened up to this point, you know. One of the problems too is when you provide data, as you all know, and I do the same thing. I mean, I come out of a corporate background. We you know, I was in sales and marketing, and we sold and we marketed, but we were constantly looking at data to tell us what we thought would our position. The minute you see data, you have 15 more questions, which will inform you in order to draw a more detailed opinion. And in order to do that, you really have to have the source data. You really have to see how those numbers that you're given are comprised, and then look at demographics and so forth, and that's what we don't have. So I'm not, you know, I'm not howling at the moon. I'm going to try to give you as much as we have. If we get it, we'll share it. And if we don't have it, we don't share it because we don't have it.
Are there any resources to target different populations that are not getting the vaccines as quickly? To explain it, to, is there something available that we can disseminate to the community?
Liz, I think, you know, what we expect to see coming shortly, and the state has highlighted this, we're pretty clearly concerned about populations of color, both in the African-American community and the Latinx community, that there's much greater unwillingness to take the vaccine. There's also a significant unwillingness by age, and that cuts across all ethnicities. You'll see young white men particularly as unwilling to take it as you would have African-American men and of a certain age. And so we're trying to figure out with the state what we're going to do to promote it when we reach the point at which we have enough vaccine to satisfy the demand. Because once we reach that point, then we're in the area of having to make the extra effort to reach the people that we couldn't vaccine more easily. And I think that's what, in the short term, the state is looking at for pop-up purposes. That's why they went to Peekskill and Port Chester with the pop-ups. I also think that's why, if you noticed, and I'm sure you would have caught this because it wasn't public, the Yonkers facility, when it opens up, for the first week is only going to be open for people who live in specific zip codes in Mount Vernon and Yonkers. It's actually all of Mount Vernon, and 4 zip codes in Yonkers. And it's targeted to those areas of the city of Yonkers that we know are heavily populated by African Americans and Latinx. So I think there's that effort trying to move in that direction. In terms of getting perhaps some marketing tools, you mentioned having something to hand out. We were happy to work with the town previously in some communications, video communications, on the front end of this when we were dealing with some of the other issues. So we would be happy to work with you on that if you see an Ossining specific messaging, and we could put some things together with you. Catherine Chaffee, who I think she lives actually in Newcastle, but she's an Ossining school mom. She's very Ossining oriented, so I think she could work with you and come up with something Ossining specific as you see fit, and then target it to those communities that you think make sense. And if there are other, other demographics, not just by age, it's gender specific, whatever it is, we'd be willing to work with you on.
Yep. One other thing I noticed, I've been hearing from some of my older patients, they got to a place where there was a vaccine, they had an appointment, but they didn't feel they could physically stand that long or park that far, and they left because of their physical limitations. So I know that you're having the pharmacies do the older people, and I think that's great. Is there a way to further accommodate them?
Yeah, the unfortunate part is we have people that are outside our facilities, county police at our clinics and so forth. And one of the problems is that the people don't tell us that they need assistance. If they drive up, to the front and they roll the window down and they see a police officer, county police officer, they say, "Officer, it's hard. I've got a walker. Can you have somebody help me?" And then we'll have somebody work and help them. But as you mentioned in one example, and there are others like that, where people don't see the help or they don't know that there's help, and so they just assume that they'd have to stand on a long line. We've also had a couple of situations, not many, but a couple of situations where when we've had impending snowstorms, happened 3 times, an impending snowstorm in the afternoon, people come much earlier than their appointment. And instead of having the normal flow, which is pretty manageable lines, we start getting these much more robust lines because you're getting more people coming at a time where they can't get through. And a person drives by and sees that, and they say, well, I'm not going to stand down around the corner. And in situations like that, if you've got the 9:30 appointment, we'll bring you right in at 9:30. You won't have to stand on the line. But getting out that message it can be difficult. And it also, Liz, winds up happening to be what happens at that moment, in that real-time moment, who's ever on duty, how well do they grasp the situation and address the situation in that moment? You know, we try to work after we had the last time this happened at the county center. I drive by every day just to double check. If I get out of here, no, it's too late now. But if I get out at the end of the night before it's closed down, I drive by just to look to see. And for the individuals that approach you, if you have mobility issues, call ahead. But when you confirm your appointment, say, I need assistance, and we will have someone come, so you can identify yourself when you pull up, that will help you do what you need to do to get it.
Great. Thank you.
Thanks.
And you are doing a great job.
Thank you, Liz. I appreciate that. And I'll take that on behalf of all the people on this team. We've got a very good team of people, and I long since learned in my corporate years, you don't take credit when other people are doing good things. So I'm just, I'm doing my portion of the job, but so many other people are doing a good job, and I will convey that credit to all of them.
Well, we appreciate all the people from Ossining that you have on your team.
Yeah, we feel pretty good when we have somebody from Ossining on our team. It's pretty sharp. Andrew Ferris has been my right hand for a long, long time. He was a college intern 10 years ago. He worked for me as an assemblyman, and now he's chief of staff. And any day he's going to be a dad.
Yeah.
So Megan is due any day. We're all excited about it. So
fantastic.
But,
just as a follow-up to Councilwoman Feldman's question, is there data at all on the reason that people are, like, varying groups might be pushing back against the vaccine? I'm sure that, there's some just doubt, but do we know anything else about that?
The basic data that we have revolves around the occupational cohorts, where we can identify how many police officers, sworn officers there are in a department, and then how many requested vaccination, and then how many got the vaccination. And then the delta represents the percentage of people that did not want to do it. We have police, fire, EMS data like that, and we're trying to, as we try to vaccinate the teachers, we're developing data like that. We can't go with individuals, that's HIPAA law. As long as we're aggregating numbers, that's accurate. And that's really where my comment about younger men come from. I just today had lunch with the new head of the Superior Officers for the Correction Officers Benevolent Association. And I commented that the number gap between number of sworn officers, number of people that took vaccines was a surprisingly large number. And I asked him, he said, we kind of pre-polled, and we got a lot of young guys who are very physically fit. They don't think they need it. They're as affected by the rumor mill as others are. This has been out there that long. What's in it? I don't know what's in it. And, sometimes when I hear the questions, I'll say to somebody, I said, you don't know what's going to happen in the long term. Nobody does. This is a vaccine that has just been developed to deal with the problem that's just developed. You don't want to take it. You want to wait to see what happens in the long term, but you're risking getting the disease, and it may be affecting you. And so people who don't think they're going to get it or don't think they're going to be affected by it make that gamble. And, we're not at the point yet where we're mandating people to do things. It's just like getting people to wear masks. You've gone through this, trying to enforce it on the town level. We don't want our police officers in constant conflict with everybody that doesn't have a mask on. But by the same token, there's some people that willfully won't wear a mask. They just won't. And you'd have to force them to do it, or you'd have to evict them from whatever the location is. And I'm afraid, there's elements in the society of people that just have lost any trust in anything, any institutional thing that they hear, they don't trust. A friend of mine, this is a bit humorous, but a friend of mine said, "What's in the virus?" I said, what's in the vaccine? I said, "What's in the vaccine? I'm not a medical scientist. I don't know what's in the vaccine. It's something that will protect you from coronavirus." He says, "Well, I won't take anything until I know what's in it." And I said, "You eat a hot dog, don't you? What's in a hot dog? What's in a Pop-Tart?" you know, we don't know every single thing about everything that we are doing. In a sense, we have a certain sense of faith that the FDA has looked at this, has approved it. And I hope what will happen is the longer we go vaccinating more people of all different backgrounds, so we deal with the ethnic issues, the ethnic concerns, which are not illegitimate, but, you know, they can be addressed. If you see 100,000 people in Westchester County, if you see 500,000 people in Westchester County get vaccinated and nobody gets sick enough in the hospital or die, then that pretty much tells you that it's safe. And you have to, at some point in time, you know, move from there. But as I said, I'm not a medical scientist. You know, we're just trying to figure our way through it day by day.
One other point that I was talking about with some of the doctors, some of them don't want to take it because they already had the virus. So you might want to put another category of, are you not taking it because you've already feel you've established your own natural immunity?
That is a legitimate medical situation, Liz, as I have heard. And it does differ if you've had the virus, and particularly if you've had the virus fairly recently. If you've had the virus and there's like less than 90 days, then you should not take the vaccine, as I'm told. You know, I always wondered why at the end of all of these things you see on TV where they're advertising a drug, there's Belsis or these things, and they solve different. Yeah, and then they give you about, you know, 25 qualifiers. Don't take this if you're this, don't take this if you're that. And when you listen to that stuff, it's like, I don't think I'm going to take it at all, because it doesn't sound like, you know, something that's safe enough for me to take with all the side effects. But, you know, again, we're trying to figure our way through it. We will try to mount, and with your help and customization, we'll try to mount some persuasion effort. I won't even call it education, because when you say you're going to educate somebody, that's sort of insulting. They think they're already knowledgeable. You're going to try to persuade them. You're going to give them reasons to reconsider their decision not to take it. But again, right now, we don't have enough vaccine. So if we could persuade a bunch of people to take it that we wouldn't be able to satisfy the demand by giving them the vaccine. So I think we're going to see that persuasion effort come a little bit later on in the year once we know we have enough supply. So I'm going to thank you very much for your courtesy. You've all been very gracious. I hope, as I said, I didn't put everybody to sleep, but it's always nice.
No, not at all. I was gonna. You didn't want. Are you off to something else? Because I just wanted to make sure.
Pelham Village is the next stop on the train.
Okay, fair enough.
Next stop is Dobbsbury, but it's good to see my friend Northern. I've known for many years.
Yeah.
Great. He and I have been in a couple of settings outside of this one, so it's good to see you all.
And I got one question.
Okay.
And it's a simple. I'm afraid of needles, but I'm gonna do what I have to do. But why don't you see if you can get a pill?
All right, I'll work on it. I was just at the dentist, Northern, about 5 hours ago.
Oh boy.
He put a Novocaine needle in my face, and you know, whatever they're gonna do with the shots, you know. You know, guys, we can't show it. You know, we got to show we're solid, man. We can't say, don't do that. You know, we're afraid of it. Just gotta take the shot, man. Just take it.
I'm sorry.
All right. Thank you very much for the time. It's always a pleasure to be with you.
Thank you so much.
I hope we'll see each other in person before too long. Have a nice day, everybody.
Have a great night. Thanks.
Bye-bye now.
All right. Well, that was a lot of great information, and we, you know, do share regularly whatever information we receive from the county. We do our best to share it out with the public. Anything that is, you know, public for public consumption, we always try to do that in our weekly updates. So we'll continue to do that as we get more information. I actually thought there was going to be something happening in Austin for vaccines based on something I saw from Assemblywoman Gale's office, but it was more testing. So there is actually going to be testing available this Sunday from 10 to 3 at the Austin Community Center. So I just want to make sure that everybody knows about that. And you can go to westchestermedicalcenter.org or call 914-202-4530 to make an appointment. And there are a number of other testing locations in Austin. I know OVAC has the rapid test available, and they have spots available. And we're going to continue to share that on our website, on our Facebook page as well, as well as the update that I send out on Fridays. So if you're not feeling well, or if you have recently been in a gathering of people, not from your household, you should get tested to make sure you take proper precautions and do not spread the virus to others, because you can certainly do that even if you're asymptomatic. So take precautions and do get tested regularly. There's a lot more testing available now than there had been, obviously. And And I think that with that, we're probably going to hop off of Facebook Live for the rest of our meeting. If you do want to join our Zoom webinar in progress, the webinar ID is 829-0529. Password is 357975. The link and access information is also available on our website at townofaustin.com. We always do post a recording of our meetings to our YouTube and to our Facebook pages, so you can also wait for the recording if you have to get off to enjoy dinner with your family. But we do thank you all for joining us on Zoom this evening. And with that, I'm gonna take care of a few announcements and then we'll get into the rest of the meeting. It snowed yet again yesterday, and we are grateful yet again to our highway, parks, and cemetery teams who leapt into action at the first sign of the winter weather creating issues on our roads. There does not appear to be any significant snow in the forecast for the next week or so, so let's knock on wood. And we can all take this time to make sure our driveways and our sidewalks are clear. The Austin Fire Department would like to remind residents that you should always clear snow from fire hydrants so that crews can reach them quickly in an emergency. Their mantra is second count, dig them out, which is fun and catchy, even if it doesn't exactly rhyme. Tonight, on a different Zoom, the town of Austin partnered with Sustainable Westchester and several other local organizations, including Green Austin and the Sustainability Committee in Briarcliff, to share information about how to lower your heating and air conditioning bills, all while using clean energy and getting off of fossil fuels. We co-hosted a similar session in January, and we're excited that so many people were interested in coming on board. We had over 100 people this evening, which is incredible. The webinar wrapped up just before this meeting. It may have even got a little late, and it covered financial incentives available, the Grid Rewards app, the Carbon Tracker app, which you can track your carbon usage as a family, as a household, as individuals, as well as other green and money-saving solutions for your home. And it also gave everybody a chance to speak to contractors for different types of heating and cooling solutions and energy savings. If you're interested in learning more about the Energy Smart Homes program, you can watch the live streamed recording of the meeting on Facebook, and you can also contact Sustainable Westchester by calling 914-242-4725, extension 122, or visit their website at sustainablewestchester.org. Tomorrow, the Austin School Board will be honoring one Ms. or Mrs., I should say, Francine Vernon for her distinguished service to the Austin community. We are pleased to join the school board in recognizing Mrs. Vernon, as she is known throughout Austin, with a proclamation in her honor, and by naming Saturday, February 27th, 2021, Mrs. Francine Vernon Day in the town of Austin. Francine is a lifelong advocate for children and youth development programs and has served on the school board, the Austin Community Action Program, worked with the Westchester Library System, and has helped many other organizations. She's also a member of the town's Community Equity Task Force. We are so very proud to show our appreciation for Mrs. Vernon tonight, tomorrow, and every day. And I look forward to getting the physical version of this proclamation to her after the ceremony. So congratulations to Mrs. Vernon. The Austin Public Library is hosting AARP's tax aid program again this year. Tax assistance is available every Thursday by appointment. To make an appointment, call the library at 914-810-3384 and be sure to leave your full name, phone number, and the best time to reach you in your message. In order to make the appointment, volunteers will call you back and ask a couple of questions, explain the new COVID-19 protocols, and help you prepare for your in-person appointment. If you are uncomfortable meeting in person, the AARP is also providing no contact tax preparation via email. The Austin Parks Habitat Stewards are leading a guided forest species ID walk at Ryder Park on Saturday. Tromping through the mud and snow, we'll see what that is. Meet at 10 a.m. at Ryder Park Pond, which is by the lower lot and baseball fields, to learn how to identify the trees on the park's woodland trails. You may have to park near the playground though, because the lower lot is not usually plowed. Registered for the program through the Recreation Department's Community Pass program. A link to Community Pass is available on the Town Parks and Recreation page of our website. Be sure to wear your snow boots and dress warmly. Saturday is also a Spanish language session for the Police Reform and Reinvention Collaborative. These sessions are a chance for the community to weigh in on local policing. I encourage everyone to participate and make your voices heard. The collaborative is an initiative required by Governor Cuomo in response to calls for social justice. Police departments across New York State must review their policies and adapt based on community feedback before submitting their plans for change on April 1st. You can find information about this program on the Village of Ossining website. On a sweeter note, pun intended, sugaring days are back at T-Town. The Warren Sugar House is one of the oldest structures at T-Town, and it is used to produce maple syrup. You can join in on the fun every weekend through March 20th. Tours are limited to families for 20 minutes each due to COVID safety protocols. You can register for this fun program on the T-Town website at www.ttown.org or through their Facebook page. And rounding back to where we started our meeting on a final, very sad note. Starting this week, we will begin to pass anniversaries of events caused by COVID-19. In fact, it was at our meeting this week last year that we mentioned preparations for the pandemic for the very first time. This will be an incredibly difficult and painful time for many families, and I encourage everyone to seek out help if you need it. Ossining is home to some amazing support organizations and nonprofits. Additionally, government offices at the county and state level are managing information helplines that can connect you to emotional support services, healthcare resources, and much, much more. We have all been through so much this year. It can feel very overwhelming, but hopefully we have turned the corner on this virus and we'll be soon getting back to some normalcy. You can call 1-844-863-9314 for mental health counseling through New York State. If you need other resources or need to be connected with a particular service, please do not hesitate to contact my office at 914-762-6001 or by email at dlevenberg@townofossining.com. Also, I'll just do one more shout out or request for volunteers. If anybody's interested in helping connect seniors who are not necessarily able to get themselves set up for a vaccine appointment, we're trying to put together a program similar to what Greenberg put together, a COVID Angels program. They've shared some resources. We're looking for some leaders, but also people who are willing to make phone calls. So if you're either or, we would appreciate you reaching out to those same two numbers, 762-6001 or dlevenberg@townofossining.com. Do any of my other board members want to share any announcements?
I just have one on the taxes. The Ossining High School will be doing the VITA program, which is the Volunteer Income Tax Assistance Program. I have to think about that. On Monday evenings only. To make an appointment, dial 211, and if you're eligible, you can get an appointment and get information there.
211 is another great resource if you need help for anything also through the United Way. That's great. Anybody else have any other announcements? All right, so then we're off to our liaison reports. Are there any liaison reports this evening? All right. Hearing none, I am excited to introduce this evening our tax receiver, Honorable Holly Perlowitz, who's here for a departmental report. Holly and her team are fresh off the second half school tax collection, which just happened to coincide with the worst blizzard we've seen in several years. Nevertheless, with some help from our town clerk, Sue Donnelly, and Highway Superintendent P. Connolly, Holly was able to make herself available for extended hours prior to the storm and even womaned the office as the rest of us hunkered down as the snow fell. Thank you, Holly, for your dedication to our taxpayers, and we are looking forward to hearing your report. And you're muted, so unmute.
You'd think after a year I would have known.
It's the
All
moment.
right.
Yes.
So, thank you. Thanks. Victoria, do you mind sharing the screen for me? Appreciate it. As Dana mentioned, we are fresh off our the second half of school tax collection. But before that, let me just sort of go through the two warrants that we had this year and let you know, we can see where we are. So the town and county taxes, which were due April 30th, we have now collected 99.1% of the town and county warrant, which is great. We also, on the school warrant, now that we've been through both of the halves collected, we're at 97.6%, which is actually slightly better than last year, which was at this time was what, 97.4%. And as Dana mentioned, I think that the collection in January went really well. I'm continuing to see an increase in the use of the web, both people doing it on their own and also us sort of acting as a help center, and people who are either don't have a computer or just don't have a comfort with it will call us and we'll be able to walk them through it or do the transaction for them. Also to mention, I think people were absolutely astounded that we were open on the day of the blizzard, and people with big trucks were able to get to us and make their payments in person. We also decided to stay open the Saturday right before the blizzard in anticipation of the blizzard. And frankly, I had always been suggested that people wouldn't come in, but people did come in. And I have now concluded that I'm going to work towards doing that for each collection, be open the Saturday before the last day of the collection, because I think people felt very accommodated. And I'm just always looking for ways of making it easier for people to pay. And I think people appreciated that. So far, as I mentioned, we're at 97.6% of the school collection. So I think we're happy with that. We sent out the delinquent letters last week, and that's resulting in a lot of people paying now as well. Frankly, there are those people that just forgot. And while of course everyone's upset about having to pay a penalty, as you all know, it's the law. So I can't do anything about that. And while they're not always happy to hear, I think that when I explain that I myself, when I first got this job, thought it was a pretty harsh rule, but it has to be. And because A, everyone has to be treated equally, and B, the towns and schools need to function. So I think people understand, and the impact really is I'm signing up more people for the tax alerts, because that's the way to not forget. And I think people are very, very happy with those. I get compliments on those all the time, on the tax alerts all the time. With that, I want to talk about the delinquent tax liens. I sent all of you a more detailed schedule so that you have it. But I just wanted to sort of walk through some points. Obviously, the 2016 and 2017 liens that are still out there relate significantly to the people who have payment plans. And we do have currently 13 parcels that have payment plans, but it's really 10 taxpayers, because one of our taxpayers has four properties involved, and taxpayers are complying with their payments, and they're really very grateful that that we were able to do that. And on the 2018 liens, we have one that's ready for auction, and we are eventually going to, thanks Victoria for putting the cursor there. We have 2018 liens have a redemption date of May 7th, so we will eventually have an auction related to those as 2021 moves forward. But what I also wanted to mention is that we've made some significant progress with some large commercial properties that had liens against them, one of which paid off in January, which amounted to $575,000, and that was the Ossining land. I mentioned that the last time I spoke to you that they had a significant lien, and we were very grateful that they paid off. And I've been told that, and I've been working with the law firm that's handling a closing for the research center in Briarcliff, which owes both town and school taxes. And they're going to pay off on Friday. So that's a really good, a good thing that's happening. Once they pay off, I'll let Dana know, and Dana can inform the rest of the board once I actually have their funds. We do have two other commercial properties that have significant liens, one of which is the Red Lion Apartments. You know, we've reached out to the management company, and I guess they're having some struggles, but it's clearly the intention is to pay us eventually, and Paradise Heating as well. Both of these they have liens that are included in the 2019 and 2020 or 2020 section, but they also owe 2020 taxes as well. So hopefully they'll be able to clear that up. So I think the takeaways are that we're in really good shape with the 2020 tax liens. We've made significant progress with the liens. Usually, if you look at the 2020 line, usually over 70% of those will pay off by the end of the year. And we also constantly look for ways to improve. You know, I have the laws that I have to abide by. So that's sort of where I'm at. And I have technology that I can use the best I can. Information, customer service, I'm very big on that. I don't want anyone's email or phone calls to not be responded to, certainly by the end of the day, if not within a 2-hour period, but certainly by the end of the day. And I'm always listening to our taxpayers too. You know, any of the suggestions that I can somehow implement something better, I'm anxious to do that. And certainly research it for them. I want them to know that their thoughts are heard. Of course, the law is the law. And while it is sometimes hard to take, I think the vast majority of people recognize, you know, that they forgot. They sign up for the email alerts. And I share, which is the truth, before I took this position, you know, I've been here 34 years. Many years ago, we missed it once, and it was a very hard life lesson, and you never do it again. So with that, if there are any questions, I'm delighted to take those. I know that the document that I sent is very rich in detail. So certainly if you have any questions, you can reach out to me. But if you have any questions now, I'm delighted to take them.
Thank you so much. As usual, you deliver the worst information in just the nicest way. Can I ask my more colleagues if anybody has any questions?
Actually, I wanted to pass along a compliment to your department, Holly. A resident called me to ask how they could get tax information, and I gave them the number and said, you know, call Holly. She's super friendly and extremely helpful, and you know, and she sent me a text back, said Patty is also super friendly and extremely helpful.
Yes.
So you know.
Great. Thank you. Thanks.
And that she got everything she needed. So.
Thanks for sharing.
Apple doesn't fall far. Thank you for setting the bar so high, Holly. We really appreciate it. Anybody else? Questions?
I think the Saturday is awesome that you're doing that. I think that's going to be very well received. I know a few people that have wished for Saturdays for a while, so I think you're going to make quite a few people happy.
You know, it's such a small thing, and as long as we are able to do it, I am delighted to do it. And I was very happy at the number of people who came in and really were grateful. So it's one of those things, you know, the blizzard happened, so we did it, and now we tested it, and it worked really well. So we'll just continue it going forward. We're all around to learn, right?
Yeah.
Very much appreciated.
Do we know when the auction's going to be?
Well, actually, Christy is working on the agreement, and I think she's got one now. So we're going to negotiate it with them. So I'm hoping soon. Soon.
Thank you.
Right now, there's only one property. You know, there's only one property to go.
Christy, did you want to say something? No. Okay. All right. Well, thank you again so much to our tax receiver, Holly Perlowitz. We are very appreciative of the departmental report and all the hard work that your department does. And again, grateful for the extra sticking your neck out for our taxpayers to make it easier for them to pay on time. Very much appreciate that. And even as you say, the rules are the rules. We appreciate that. So I think next up, we are going into our public comment on agenda items. Is there anybody here from the public who has a comment on any of the agenda items? It's a short agenda, but if you have any comments on any of those A through D, etc., let us know. You can just raise your virtual hand if you want to be recognized. And seeing none, we're going to go into our board resolutions.
Okay, approval of minutes, regular meeting, February 9th, 2021. Resolved that the town board of the town of Austining hereby approves the February 9th, 2021 minutes of the regular meeting as presented.
Do I have a motion?
So moved.
Second.
All in favor?
Aye.
Anybody opposed?
Approval of minutes, special meeting, February 16th, 2021. Resolved that the town board of the town of Austining hereby approves the February 16th, 2021 minutes of the special meeting as presented.
Do I have a motion?
So moved.
Second.
All in favor?
Aye.
Aye.
Anybody opposed?
Approval of voucher detail report. Resolved that the town board of the town of Austining hereby approves a voucher detail report dated February 23rd, 2021 in the amount of $544,885.24.
Do you have a motion?
So moved.
Second.
Discussion? Questions? All those in favor?
Aye.
Aye. Anybody opposed?
Appointment Highway Department. Resolved that the town board of the town of Austining hereby appoints Alicia Santucci Austining to the part-time position of office assistant automated systems in the town of Austining Highway Department at an hourly rate of $18 effective February 23rd, 2021. And be it further resolved that this appointment is temporary for a period of 90 days, and a probationary appointment of Ms. Santucci to the position of office assistant automated system is subject to Ms. Santucci's completion of the written civil service exam and approval of Westchester County Civil Service.
Do you have a motion?
So moved.
Second.
So Alicia Santucci has been working with the town part-time for over a year now, but she wasn't quite in the right title in the eyes of civil service. We're happy to be making that correction tonight and are quite sure she will pass the civil service exam with flying colors very soon. Alicia also pinch hits for the cemetery and parks department, and we're very grateful to her for her hard work on behalf of our taxpayers and families with loved ones buried at Dallas Cemetery. Any discussion or questions? All those in favor?
Aye.
Aye. Anybody opposed?
Okay. Correspondence to be received and filed. Resolved that the town board of the town of Austining hereby accepts the following correspondence. Ecogy Energy Mary Knoll Solar Resolution of Approval, December 16th, 2020. Parth Knowles Revised Resolution of Approval, January 20th, 2021. And Town Planning Board Minutes from January 20th, 2021 and February 3rd, 2021.
Do I have a motion?
So moved.
Second.
All those in favor?
Aye.
Anybody opposed?
Moving on to the monthly reports. Resolved that the town board of the town of Austin hereby accepts the following monthly reports for the month of January 2021, Town Building Department.
Motion?
So moved.
Second.
All those in favor?
Aye.
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 Anybody opposed? All right, fantastic. With that, we are into our visitor recognition section of the meeting. And we ask that anybody who has anything at all to address the board, please let us know and we will unmute you and you can address the board. You can raise your virtual hand, you can yell, scream. I don't know, actually you can't unmute yourself. Okay, so thanks everybody so much. If I could have a motion to adjourn to executive session for personnel, advice of counsel, and contracts.
So moved.
Second.
All those in favor?
Aye.
Aye. Anybody opposed? Again, thank you so much for joining us tonight. Our next meeting will be a work session on Tuesday, March 2nd at 7:30 p.m. As usual, you can join us via Zoom or dial in by phone. Information for each meeting is posted on our website each Friday and included in my supervisor's report. Have a wonderful night, everybody. See you soon.